Hello, this is Dr. Mercola, and today I'd like to talk to you about a condition that can be psychologically and emotionally painful for many people, especially adolescents, and that condition is acne. Now, I've got lots of experience with this personally because as a child growing up, and even into my late 20s, this is a condition I personally struggled with. In fact, I had a relatively severe form of the condition called cystic acne, which would produce these large and painful and very hideous-looking lesions on my face that was certainly very embarrassing. And the challenge, of course, is to try to treat this effectively. And if you read most of the experts on this, you seek a professional consultation from a dermatologist, their typical strategy is to recommend an antibiotic. An antibiotic means just that. Anti is against and biotic is life, against life. So these antibiotics, typically tetracycline type derivatives, are designed to kill infections, and these are typically infections on the face, typically propioniform types of bacteria that are responsible for the actual inflammation and infection that does occur on the face. And these drugs can in fact be very useful to clear up the conditions. And of course you can use topical agents such as benzoyl peroxide, and you can even in extreme cases use Accutane, which is something that you really, I don't believe anyone should be using. It's actually one of the only drugs that's classified as category X, which means it's guaranteed 100% will cause birth defects. And if a woman is of childbearing age, it's illegal, as I understand, to prescribe these without actually getting a pregnancy test. So these are conditions that in no way, shape, or form will treat the underlying condition. So what you want to do is to eliminate the reason why these propioniform bacteria are going on the face, causing the acne cyst and lesions. And the way you do that, there's some very simple strategies that work nearly every single time, and I wish I would have known these when I was younger. What most experts will tell you about acne is that diet has nothing to do with it. Well, nothing could be further from the truth, because what has become clearly apparent is that your diet has everything to do with it, and that the foods that you eat, and if you are predisposed to developing these acne lesions, and if you are eating a diet that is causing your insulin level to rise and increase associated insulin growth factors, especially IGF-1, then you will have acne. And the solution to this is really very simple. It's just to eliminate or radically reduce the amounts of foods that you're eating that causes your body to make insulin. And those foods are really quite simple. They're pretty, for the most part, any grains or carbohydrates. And the confusion here is that you would think that you could have a healthy grain. So that if you would have a high quality whole wheat, organically grown, organically processed whole wheat bread, from even if you made it yourself and stone ground whole wheat flour, it's still going to cause the problem. It's because it's a carbohydrate. So any wheat products, any grains, breads, cereals, pastas, rice, potatoes, corn, all these are carbohydrates. And corn sounds like a vegetable. It's actually a carbohydrate. It's a very high density carbohydrate. So if you have these types of foods, and even fruits, your body will likely increase the amount of insulin. As a result of that, you will have challenges with acne if you are predisposed to it. So my strong recommendation is to give it a try, to limit these amounts of carbohydrates in your diet and to replace them with vegetable carbohydrates, because those are carbohydrates that are slowly metabolized and they will tend not to cause this type of reaction. Now, do you have to consume this diet the rest of your life? No. Just try it and use it until the acne condition is controlled, and then you can gradually reintroduce these carbohydrates and these healthy grains, preferably limitedly processed grains, until your condition is under control. Now, there are two other important factors to consider, especially if you've tried a conventional approach for acne, and that is, if you've been given antibiotics, it's very important to go on a probiotic, because what the antibiotics do is they are not discriminate. They don't just kill the propioniform bacteria on your face, they kill good bacteria in your gut. And when that happens, you can have side effects, especially if you're a woman. You tend to be predisposed to something called the yeast syndrome. So you want to reestablish that good bacteria by taking a supplement with that. And of course, by lowering the food or the fertilizer for the bad bacteria, which is the carbohydrates that increase the insulin, you will also help reestablish the proper balance of good bacteria in your gut. And lastly, what we're finding is that vitamin D is crucially important to establishing a healthy immune system and controlling pretty much any type of infection. Because what we've learned is that when you optimize your vitamin D levels, you make over 200 antimicrobial peptides. So simply exposing your skin to healthy amounts of sunshine, enough sunshine that's going to cause your skin to turn a very light pink. Any more than that, you're going to get, it's not going to make any more vitamin D. And you only cause skin damage. And if you get to that level of vitamin D and sun exposure on large amounts of your skin through either exposing it to the sun or a safe tanning bed, then you will optimize your vitamin D production and virtually eliminate the need to do any blood testing. But if you just don't have availability to the sun or a safe tanning bed, then you're going to want to consider supplementing with oral vitamin D. And typically those ranges are several thousand units a day, from anywhere from 2,000 to 3,000 to as much as 10,000 units a day. But if you're going to choose that route, it's definitely one I would highly recommend, but you really should only do it if you're going to monitor your blood levels with a blood test. Very important to do. So these are the simple strategies that I wish I knew when I was younger, that I encourage you to try and adopt for yourself if you struggle with acne, for anyone you know, because there's a strong probability that it will virtually eliminate the challenge and really all the associated emotional and psychological pain that's associated with this disease. So hopefully this will be helpful as a resource and a tool to help you take control of your health.